several different causes of heel pain. The most common we talk about is plantar fasciitis, but you can also have heel bursitis. Tarsal tunnel syndrome can create pain in the heel, which is essentially a compression of a nerve going to the heel. You could have a stress fracture of the calcaneus or the heel bone, and that could have result in heel pain as well. So it's important to have it evaluated. If your pain is not getting better, then it's good to go in and have an evaluation and perhaps do an x-ray to take a closer look and see if there's anything else going on. So typically people who come in with plantar fasciitis have pain often after they get up in the morning or after they've been seated for a while, and the pain usually gets better throughout the day and then often worsens after doing a lot of walking or activity. So plantar fasciitis is an inflammation of the ligament on the bottom of the foot. It often comes from overuse, and it can also come from wearing unsupportive shoe gear or walking barefooted frequently. So there are several treatments that we typically start with when you come in with heel pain. One is just getting into better support, so trying to cut out all of the barefoot walking, especially around the home. So you want to be in a very supportive shoe, typically a walking tennis shoe that's stiff-soled and not very flexible. You also want to be in a good orthotic or arch support. These can often be found over the counter, and your podiatrist can help guide you toward a good one to find. There's also the option for a custom orthotic if needed, and that is something that can be provided here at the office as well. You would be cast for that with plaster cast, and then those are created custom to your foot. We also get you started on some stretching exercises, some anti-inflammatory medications, and even possibly a steroid injection into the heel to help relieve some of that inflammation. Bursitis is an inflammation of the fat pad surrounding the heel, and this is very similar to the pain you would experience from plantar fasciitis, but this can happen really in anyone with kind of overuse, and it tends to happen frequently in people who walk barefooted. We see it a lot in people who don't have as much of a fat pad around the heel protecting it. The best time to seek help is if you're not getting better. It's certainly not something to suffer with. There are plenty of conservative treatments. There's even things we can send you out for, such as physical therapy or other alternative treatments to get you feeling better. So it's certainly not something to suffer with on your own for a long period of time. There are times when surgery does become a good option, especially if patients have had plantar fasciitis that is not improving with aggressive conservative treatment. Then occasionally we do take people in for surgery to release the ligament, and that can be very effective in improving the heel pain.